Hello and welcome back to another episode of the Core Consult RX podcast. And Cole obviously moved away, but we're in the studio today live. Cole can't be with us, but our long lost friend, Dr. Kaleigh Steeleman, is with us today. Kaleigh, what's up?
Hi, you guys. How's it going?
Good. It's good to have you back. This is third appearance, I think we said.
I think so. And my first appearance as a
PharmD.
As a pharmacist,
Absolutely. Yeah. So Kaleigh was a student with me on rotation. When was it? Last summer, I guess it was?
Yeah, because you were my first rotation.
Yeah, okay. So it's been over a year now at this point. And what have you been doing since graduation?
So I am now a resident at UNC Chaple Hill. I'm in their community-based pharmacy residency program. I'm at 2 independents in Chaple Hill because I eventually want to own my own independent. So I'm getting a lot of business background, learning a lot from some incredible pharmacy owners. And in the meantime, as you know, because you helped me start, I am still working on my RX cheat sheets account and publishing study guides and helpful materials for other students.
Absolutely. And I was wondering if residency was going to be one of those things where you had to put it on pause and all that, but you've been rocking and rolling with it ever since graduation. So that's awesome.
I have been, and I think it's even been growing a little bit because my pharmacists have seen it as an incredible opportunity, and they're helping me do different avenues and maybe do some videos, reels, whatever. But yeah, they're helping me out there.
Do you feel like it's something that because you're making the content, it's helped you to kind of continue to learn or keep up to date or whatever it is?
Oh, for sure. Especially doing topics that you don't see every day in community, like oncology, drugs, stuff like that. It's been helpful so I can keep fresh in those topics as well, and then explore avenues that I'm more interested in, like dietary supplements and natural medicine.
And for people who haven't seen RX cheat sheets on Instagram or social media in general, can you give us kind of a little bit of a summary of what you do and what kind of content you have on there?
Yeah, so I just I have always been a little bit artistic, so I make my study materials more artistic, colorful, more visually appealing to the eye, if you will, compared to like a PowerPoint you would see in class. And so along the way, people would ask me for my notes and I would provide them. And when I was working with you on rotation, you were like, hey, you should share these for more people to see. So I just turn our PowerPoint study materials into PDFs and make them visually appealing and put them out for people to see. That's
awesome. And how is it growing from when we were talking about it, like you were first kind of having it? Because I'm pretty sure we even kind of came up with the logo and stuff while you were on rotation with me, right?
Yeah.
So now that it's been over, a year and stuff going, what's been working? What's been frustrating about it?
Oh gosh, I don't know what's been frustrating. I think maybe being in residency and being busier, I haven't had as much time to devote to it as I wanted to, but I've found ways to make other types of material that aren't super time consuming, because the big study guides I make, take hours.
Yeah.
But I can make simpler like drug cards where I just do a highlight on one drug and talk about mechanism of action, side effects, indications, maybe off-label indications, stuff like that. So those are much faster. I like doing those. And then a bunch of reels for over-the-counter medicine and dietary supplements to teach people on social media about those, because a lot of people, if you're not in the healthcare profession, you wouldn't know.
Yeah, and especially in that space, I feel like there's so much, I hate to use the word misinformation, but you know what I mean. There's so much of nonsense out there that, this product does this and that, and
right.
It's almost never coming from a professional in a lot of scenarios. So that's
right.
Cool.
I actually do a dietary supplement recommendation. They're like full consultations. We just started it this year at the pharmacy, and my first patient who came to me for referral, she brought me her med list, and the bottom 2 dietary supplements said, I take these because my friend told me to take them. I was like, oh, that's a great way to start.
Yep.
Let's dive into this a little bit.
Is your friend a licensed physician?
Yeah, right. But no, so we got that figured out and made some changes to that med list. So
that's awesome. And you've kind of always been interested in like the supplements and stuff like that. Mm-hmm. Like, how far back does that go?
I'd say probably like high school because, like growing up in sports and stuff and trying to find ways to optimize my nutrition and my overall health, I've always leaned more towards non-prescription medications. I know that's a little contraindicatory. How do you say that word? Contraindicatory. You're going to edit that out.
Sure, yeah.
but it's a little bit ironic since I'm a pharmacist, right. But part of my passion is natural medicine. And there have been, my mom, certain drugs that I learned about in school, and I'm like, you're not taking this anymore, but.
Yeah, for sure. Well, and yeah, I think it's one of those things that people are always going to take them regardless, like, right. Because there's just so much information about that, whether it's accurate or not, people are going to always take them. So like kind of providing people with, what could have more benefit than others, or like, right. I think the thing we'll get into today too is like the potential interactions and like side effects, things to avoid when you're talking about over the counter stuff.
Right. And like my always philosophy has been in everything in life, like less is more. And so I grew up with the mentality, like if my great grandma who lived to be 103 can survive on, natural medicine and lifestyle changes and recommendations, then why can't we? So, I've always been more of a like preventing the medicine instead of getting on it.
Trying to play catch up.
Yeah.
So, I was in, did various sports and stuff when I was in high school and all that too. And I don't know if you're aware of this, but high school guys are some of the dumbest group of people you'll ever meet. And so we would always just take anything and everything. I was like, creatine will make you run faster, jump higher. Anything you could possibly get your hands on, we would
right.
go for it. Is this the same with the female athletes? Are you guys a little bit more hesitant?
I myself will like research it a little bit before I tried anything, but even like a few months ago, I went into a GNC and I wanted a recommendation on a product, and I kind of asked them to see what they would say, and obviously had done my own research
to get a hilarious answer.
Yeah, and they recommended I think it was L-carnitine, and it was for like a little bit of helping in the gym, toning and whatever. And then I tried it and I was so ill. I looked it up, and oral L-carnitine is about 3% bioavailable. Perfect. So I was like, what is this really doing? I might as well sniff it.
Yeah, just sitting in your gut.
Yeah. So.
No. While their polo shirts are nice and crisp, their knowledge level varies.
Yeah,
from store to store.
I think that's a reason too why I got so into this, because we have all these supplement shops around that are making recommendations like this. And do they know what medications you're already on? Do they know it may or may not have an interaction with your prescription medication? Do they know what conditions you have? I think it's all very important. And I think it's something a healthcare professional that's trained in that area should be looking into.
Yeah, absolutely. And you mentioned that you kind of been doing this throughout residency and helping people with some of that. Is that something you guys are like billing for?
We are charging cash for it right now. We'd love to see, insurance cover it as a preventable service, but we haven't started that just yet. We just launched it like 2 months ago.
Gotcha. So. I figured it probably was that. I just was wondering if you had found some way to get around some of the billing issues. That's always at least in South Carolina anyways, always a huge headache. And so what's the plan, after you finish all this training and you're finally on your own doing your thing? What's the goal?
We'll see. My end goal has always been to own my own independent pharmacy and incorporate these things that we've talked about into it, the supplement consultations, because I am dietary supplement certified now. And I want to find a way to like make the best of that. But that's always been my end goal. I don't know where I will end up, but or when the opportunity presents itself, I'll be there for it.
That's cool.
But for now, probably just looking for other jobs in independent pharmacy to get my feet a little bit more wet.
I was going to say, is that kind of what you're thinking, that you're going to stay in like dispensing, like independent type role? That's cool.
I love it.
Yeah, that's cool. One of the hot topics, and I think we're going to get into this today, is supplements in general are always something people talk about, but now with more and more states legalizing THC cannabis, and with I don't know if it's legal in all 50 states, but CBD is very widely used nowadays. Delta 8, some of these, things like that are these cannabinoid derivatives and whatnot. I think these are something that a lot of pharmacists kind of shy away from because there's a lot of stigma behind it and whatnot, but these are coming one way or the other. And we've talked about this in the podcast a little bit before, but I think it's important as a pharmacist especially to kind of at least be familiar with some of these, molecules and how they work in the body and their biochemical response, because you are going to run into patients that are taking these whether we want them to or not, and we have to figure out how to kind of navigate that along with their other pharmacotherapy regimen. Is there anything in particular that you want to start off with THC CBD? Is anything that you're got you interested with that in particular?
No, I think we should just kind of start at the beginning, work our way through
to the endocannabinoid system. I'm going to go through that real quick. I'll just do some basic stuff as I try not to read directly off this. This is all coming from my memory, everyone, so just be amazed. But basically, the endocannabinoid system, or the ECS, it's very widespread neurotransmitter system, and it has a lot of different roles as far as maintaining homeostasis. It does have various endocannabinoids that are endogenous, so we have anandamide, we have 2-AG, for example. Those will interact with cannabinoid receptors CB1, CB2, and also various other enzymes and receptors and whatnot that I'll mention briefly. CB1 specifically, though, is the receptors that are found primarily in the central nervous system. CB2 is typically predominantly in the peripheral tissues. It also has a role in immune cells. And overall, endocannabinoids, are synthesized on demand and act as a retrograde neurotransmitter. And so they can help with modulating the release of other neurotransmitters. And, the ECS overall is involved with regulating various physiological responses. It plays a role in mood, memory, appetite, pain sensation, inflammatory response. It also can have some influences over cardiovascular, reproductive, GI health, and any kind of dysregulation of the CCS is something that we have to worry about as far as all kinds of various disease states, and it's why it's such a prevalent target now for potential therapeutic agents. So definitely something that I think the psychiatry and the neurology folks are, I'll see some of them are excited about.
For sure. So
I'll kind of touch on some of these receptors. I like receptor signaling. I don't know if you guys are aware of that about me, but it's something that I find interesting. I don't know why, because I know how nerdy it is, and for most people it's pretty boring. But I don't know. I think it's kind of interesting. So I want to start off with CBD, because I think that's actually the one that's a little bit more fascinating, because that's not interacting as much with the CB1, CB2 receptors that we would typically think of with THC, but they do interact with various receptors. So serotonin 5-HT1A receptor they interact with, which we know that we would typically, when we're dealing with depression or anxiety, when we can get some at least partial agonism or agonism at 5-HT1A, that can help to speed up the symptom relief, or their how quickly they move towards remission of their symptoms. And the other thing they can also interact with that I was actually not familiar with the vanillinoid TRPV1 receptor. Is this something you had seen prior to this in some of your reading? I wasn't familiar with how it interacts or anything, but it's a receptor that basically has a lot of different downstream effects if it's activated. So it plays a role with certain neurotransmitters like substance P, CGRP, and the activation of that receptor is thought to be, from an inflammatory response, things like that. And so the CBD does interact with that and can basically antagonize that receptor. And so that's where they think it plays part of its role in its, inflammatory response, inhibition and whatnot. There's also something called the fatty acid amide hydrolase, which is an enzyme that if you inhibit it, you basically get this increased levels of anandamide, which is that endocannabinoid that's endogenous, and with increased levels in anandamide, you get all kinds of different various downstream effects as well, and that also plays a role in mood and pain sensation, memory, all that good stuff. So, and I'm not gonna go through every one of these things, but the receptor signaling, I think, is the big difference between the CBD and like the THC and some of the other more psychoactive cannabinoids. The CBD doesn't tend to have those psychoactive components to it, and a lot of times patients don't have the euphoria and some of the other things that are often attributed to THC. So it's thought to be, I guess, technically more therapeutic without the euphoria, which I don't know. I always think that it's funny that euphoria is listed as a side effect. Yeah. But I get it. But it tends to be something we think of as a little bit more mild, potentially maybe less effective too, depending on which we're looking at as far as its use. But it's definitely very widely used now because of the legality of it versus THC in various states.
Right. And I think, thinking back on the psychoactive properties of one versus the other, we can tie that into the plants that they come from, and that explains it a little bit. So the cannabinoid is like an umbrella term that includes many different compounds, including the tetrahydrocannabinol, the THC, and the cannabidiol, or CBD. And they all come from the same plant. The plant has a gene that over time will convert the cannabinoid into both THC and CBD. And you'll see some of their different formulations of CBD, and some of them are actually just degraded THC over time, specifically CBN. But the difference in the marijuana plant and the hemp plant is the amount of THC found in that plant and the plant species they're derived from. So hemp is only from the cannabis sativa plant, while marijuana can be derived from the cannabis sativa in addition to cannabis indica and cannabis ruderalis. Yeah. Is that what I said? Mm-hmm. Oh, okay. Yeah. And from those three. So I've had patients that come and say, I don't like the cannabis sativa, I want the indica, but they are requesting CBD, which is only the cannabis sativa. So it's,
is it sativa, Joe? Is that how you pronounce it? Sativa, okay. Sativa. And then indica, I think is that right? Yeah. So correct me if I'm wrong. The indica is the more sedating, right? And sativa is more of the stimulating one. So you said you have people come in that don't want the indica. You said
they want
or
that.
They want the indica. Yeah, so they're wanting more of the more mellow.
Right, but the CBD, I believe, is only from the
indica. Sativa, gotcha.
Yes.
Okay.
The THC can come from the other three, I believe. But yeah, the THC is responsible for the high effect. And then the general rule of thumb is that the hemp plants contain more CBD, while the marijuana plants contain more THC. So that would explain that.
Mm-hmm. And you sent some studies to me, as far as the efficacy of some of these. How, in your experience, just I know you're kind of new to this space, but in your experience, what's the acceptance from like other healthcare professionals? Is there people that are supporting like, hey, we need to do more research, or I'm glad that this is being looked at, or is it more pushback that you've seen?
No, I think it's pretty much accepted, mm-hmm. From what I've seen, especially the more THC products like the Delta 8, Delta 9, Delta 10, mm-hmm. And the new kid on the block, the THC V.
Ooh, what's that?
You're going to love this one. This is called diet weed or Weederall.
Okay. Cool. Mm-hmm. Is it legal?
Well, we're selling it.
Oh, sweet.
Yeah, but it's a variation of Delta 9, and it's marketed for weight loss.
So what is different about that? Do you know offhand, like what's different about that? Like why you get the different mechanism? Or
yeah, it's just a
response?
Variation in the Delta 9 instead of the THC, it's tetrahydrocannabivarin.
Cannabivarin, okay.
Yeah.
And it has less effect on, what did you say? You said something about the appetite or something?
Right. It's actually like promoting a reduced appetite. I know. Okay. I think most commonly with THC products, it increases your appetite, right? But the theory here is that the THCV actually blocks the CB1 receptor, which is known to stimulate the appetite.
Gotcha. Huh. That's pretty cool. And what about, side effect wise and stuff like that? Have you had any like anecdotal reports from anybody to explaining like how their experience with it yet, since it's fairly new?
I've had a lot of people have great effects from it. Some haven't noticed a difference. I think a lot of that comes from your experience with marijuana and if you have used it recreationally versus not. I know a lot of our patients do experience great benefit from that, from things like anxiety, insomnia, and even I think like multiple sclerosis and Parkinson's disease.
Spasticity with multiple sclerosis. Well, and I think too, you mentioned anxiety. Correct me if I'm wrong, but with something like CBD, because you're not getting the interaction with the CB1, CB2, and you're getting some other downstream effects from those other receptors, you're kind of mitigating some of the side effects of THC, like inducing anxiety and some of that.
Exactly.
So you're getting more of like a calming effect versus the potential for increased anxiety.
Right. The euphoria.
Yeah. It's interesting because same with some of the other more bothersome, like the dry mouth and thing, that shouldn't be an issue with, or at least as significantly with CBD, because of the lack of interaction with those CB1, CB2.
Right. Theoretically.
Or at least the less affinity. Anything else that's like cool that you've seen coming out that are like new, derivatives or anything that they're like working on?
I think the newest CBD that I have seen, and I don't know that it's new or not new, but it's more prominent now, is CBN, and this one is marketed specifically for sleep, and that's because it is actually degraded THC that's oxidized and converted to CBN. So maybe the sedation from the THC is helping with the sleep for CBN.
Now, what about patients that you're seeing that are just getting something like Delta 8 or THCV, or is that what it's called, THCV? Mm-hmm. How do you have to counsel on them as far as if they have jobs that could do random drug testing or anything? Is that something that you have to worry about? Because there is technically a positive that could come up on a drug test, right?
Right. We do let them know that. We actually also sell like a rapid detox.
Look at you guys.
Yeah, we're pretty progressive.
Yeah, you guys are breaking all the rules.
We got the Stonios.
Oh, nice.
Yeah.
Do they work at all?
I've heard the Stonios.
No, the detox thing, does that work at all?
Oh, yeah. From what I've heard, yeah.
What's in it? Do you know?
No, I don't. I know it's like a little capsule. So.
It'd be interesting. We'll have to follow up with that.
We'll have to.
I'm curious to see what's in there. Especially because I feel like a lot of the the remedies like niacin or it's like you're just gonna be flushed.
Right, you're just gonna be urinating a lot.
Yeah.
But no, I think we just started carrying it a few months ago. I think it's a newer thing.
That's cool.
But I mean, if everyone is going to be using these Delta 8, Delta 9, Delta 10 products that could pop positive on a drug test, it's something to think about.
Yeah, for sure. And I think a lot of places too, I think are going to like the saliva tests, and those seem to be like less likely to pick up on some of those like minor things. At least, again, anecdotally, I guess, is from what I've heard. They don't seem like they're nearly as because they're not looking for the use from like way back when. They're looking for more recent use to make sure that's not impeding your actual work performance or whatever.
Right.
So yeah, that'll be interesting to see how all that plays out, because I feel like it's going to be. Even if across the board it was like legalized, I feel like the employers and the insurance things, they're still going to be that, because it just has been for so long. It's going to take so long to actually get rid of that.
Right.
What about, is there any like drug interactions that you have to like really have on your radar? And if you don't know off the top of your head, I'm just asking you this on a whim, I know, but since you guys started this program, is there anything that you've started to like, are you starting to like keep a log of some of the things to watch out for? Or how are you kind of thinking about that?
I think a lot of the patients that come in to get it from us are not like total patients of our pharmacy, so it's hard to run drug interactions on their profile, and not really anything that comes to the top of my head right now.
Okay, yeah, that's cool. I didn't mean to put you on the spot. I was just curious. I feel like a lot of it's more on the THC side, the actual cannabis, or some of the like the derivatives like dronabinol, or some of those that are more so a concern if they're on benzos and some of these other CNS depressants or something. But what have you seen? Do you feel like the Delta 8s and some of these other derivatives are overcoming like the CBD as far as like what people are interested in and what customers are coming in for?
I think so. I think our like best seller is actually a Delta 8 gummy. And I do like that to start out with because you can, take a half or a fourth even, compared to the oils or tinctures where it's just in drops or even a capsule. Like you can't break a capsule in half. Of course they don't have a tablet because that would just, be too easy.
That would be too easy.
But I'd say the Delta 8 gummies are definitely the top seller right now.
You can take between, a fourth of those and like 78 of them, right?
Yeah, right.
There's a big range for a therapeutic.
Yeah, well, they take an hour or so to kick in, so I wouldn't take more than one at first.
Now that is an old wives' tale. They kick in very quickly, kids.
Okay.
So, no, I'm just kidding. Do not. That's false.
Don't do that at home.
least an hour. Yeah, and I think that's the thing. I've actually seen some people. I think it was Delta 8 specifically. That I had a friend of mine who took it thinking it was like a melatonin, and I guess he's very sensitive to that type of react, and he's like not enjoying it. He was like, it made him feel like kind of off and all that. So yes, take a small amount, see how you respond, and make sure that
that's happened to a handful of my friends too. They think they take one, they don't think it's doing anything. 10 minutes later, they're taking 2 more, and then they get really sick.
The classic mistake,
rookie mistake.
But so. Anything else with any of those or any of the study stuff you want to go through at all? Or, you kind of mentioned a lot of the disease states that the studies we're talking about, and I can link some of those in the show notes.
Yeah. I mean, I didn't know. Do you want to go through the studies and see what they're looking at, or?
I guess, can we just go through briefly like some of the disease states that they're talking about? Do you have one in particular you want to start off with, or?
No, you can.
You want me to just do it? Okay. Yeah. Let me just pull this up here. I had my other sheet pulled up. So there's 3 different studies, like I said, and this is by no means like, all of the data that's out there. There's tons of other reviews and things like that. But I like these because they were just kind of reviewing some of the data that, supports or doesn't support the use of medicinal cannabis or, CBD or whatnot. But there's so many different studies that have looked at things from chronic neuropathic pain, Parkinson's disease, fibromyalgia, obviously, epilepsy, like Kaleigh said, multiple sclerosis, dementia, and it's kind of hit or miss with the efficacy. I'll just kind of summarize it at that. It's not the cure all that the advocates like to pretend it is, and I'm pretty solid advocate for it. I would think from a medicinal purpose, and I will be the first one to tell you it is definitely not for everybody or a cure all like some people try to make it out to be. I also don't think it's this horrible substance that some people think it is either, especially if it's done in a controlled environment supervised by healthcare professionals. But yeah, I think being realistic with the studies and being, having it as a potential option for certain patients, but being realistic with expectations. And I guess the way I look at it personally, especially when it comes to pain, I know for a fact that opioids over time are going to, potentially cause hyperalgesia and to put the person at risk for all kinds of issues, obviously, including, overdose and respiratory depression and all that we have to worry about. And with something like THC, especially CBD or something like that, the risk is a lot lower as far as like serious complications from it.
Right.
And as long as the person doesn't have, an underlying psych disorder, the age range is also the important thing. This is also not something that I feel like, at least from my point of view, I don't recommend this to like, even teenagers or something. If they, I need something to help me sleep, I wouldn't say CBD is the thing to go with.
Well, I think you have to be 21 to buy it.
I think so too. Well, I've heard people giving it to like their kids and stuff, and I'm like,
maybe not recommended.
Yeah, maybe like let's give it a minute. But but it's something that I definitely think in the right context and given to the right patient and done safely, I think it can definitely have some benefit.
Yeah. But I mean, you're right. There is evidence there, but at the same time, there's a handful of studies on each different condition. Some of the evidence is pretty promising. Some is showing no benefit. So,
I mean, I feel like with pain or some of these other things, too, it's it's with the neuropathic issues and stuff. It's even if there's a slight placebo effect to it.
Mm-hmm.
Hey, I mean, if anything helps the patient feel better when it comes to that, like chronic pain like that, then heck, I mean, who am I to steer them away from that? Especially when opioids or some of these other alternatives we know are terrible for us and not good long term. So that's kind of my personal thoughts on it. You know, if somebody wants to stay away from everything, great. But if I had to pick an evil, I would definitely, this seems like the safer of the two.
Yeah.
In my humble opinion.
I will say my research project this year is actually about opioids, and it's been interesting to, you know, kind of see the patient's knowledge on what opioids are and the risk and benefits. And it's been really interesting to see how great some doctors are about explaining to patients in depth risk, benefits, you know, side effects, and some that don't at all. So, I would be an advocate for something like CBD as well, especially when, you know, there is such an opioid problem, or I guess epidemic in the world right now. So
yeah, absolutely. Well, what other supplements do we need to be on the lookout for then, as far as what are some hot topics nowadays in the supplement world?
Oh gosh, there's so many. I think let's start with like the difference between a supplement and a prescription drug or over-the-counter drug. So I think the biggest difference is that supplements are not evaluated by the FDA. So all supplements must have the statement on the bottle that this is not intended to treat, diagnose, cure, prevent any type of health condition, because in contrast, drugs must be proven safe and effective prior to release, right? Mm-hmm. So you can't have on the melatonin bottle, like melatonin treats insomnia, because that's not appropriate. Yeah. And then a supplement fact label would be similar to a label on a food product, you know, listing out all the ingredients, quantities, XYZ. And then an OTC label would also include ingredients, purposes, uses, warnings, instructions, and excipients. Whereas the prescription drug would have like a full package insert for you to figure out how to read. Yeah.
Well, and it's like also, it's weird because you have to show safety in these, but you don't have to show efficacy for the over-the-counter stuff or supplements or whatever. But then a regular drug, it's like you have to show safety to some extent, but it's like, or we could just slap a big old warning on there and we'll still approve it. But it's like we offset it with some of the efficacy, and we're like, how much more warning and side effects we accept based on, it's just like, it's such a weird, balancing act. But yeah, the supplements in general tend to be a little bit more on the sketchy side, depending on the, where you're getting them from and how you're researching. And I think the thing that's really crazy now is, especially when you have like some of these, there's legit compounding pharmacies that are making, the Ozempics and things like that are legitimate compounding. Then there's also some that are like, hey, look what we learned how to do. Yeah. And they're like just shipping it over. Like I get ads on Instagram about like, hey,
I know. I passed a billboard on the way here, like, get Wegovy now.
Yeah, and I'm all for Wegovy. I'm just saying, like, you got to be really careful with where you get it from.
Exactly.
Because, it's just something that if you don't, my rule of thumb is if you don't need a prescription for it from the compounding pharmacy, you may not want that.
Right.
Yeah. So it's definitely just something to keep in mind with a lot of the supplements and whatnot.
Yeah, because I've actually seen, I think it's B12, a lot of compounders are compounding with Ozempic to be able to legally do it. But
they've been mixing all kinds of stuff in there.
Yeah.
And I think the compounds that they're using for most of the places now are using is like the 2.5 milligrams per ml. So it's like different concentration too. But yeah, like I said, I'm all for it. You just need to make sure you're getting it from a legitimate source.
Right. So you asked my favorite supplement.
Yes.
Do you want to guess what it is?
Prevagen.
St. John's wort.
Okay. Cool.
Next best. But no, funny story, actually, I was on rotation last year, and I was doing a med rack, and I always ask any vitamin supplements, over the counters, anything like that I need to add. Nope, nothing. Okay. Doctor does his interview as like, okay, we're going to prescribe venlafaxine. Got Perfect. It. I go in there to counsel on him. And, starting at 4, depression, mood. And the patient was like, question, does this gonna mess up my St. John's wort?
Remember that part of the question and where I asked you if you were taking it? But
right.
People don't see them as medicine.
No.
They see it as like a benign, oh, it's a natural product. I'm like, yeah, but
Right.
you didn't pluck this from your garden. This came from somewhere.
Yeah. But, just FYI, if there is going to be a supplement that interacts with something, it's going to be St. John's wort because it induces CYP3A4, 2C19, 2C9, and 1A2, and PGP. So, it's hitting all the drugs.
Yeah, so many of them. It's ridiculous.
Yeah. So it's also serotonergic because so it's implicated in serotonin syndrome. So you're not going to want to use it with MAOIs. And actually, in that case, we had to determine they needed to space out the St. John's wort from the venlafaxine by at least 2 weeks. We wanted to play it safe. We were just don't want any risk of complications at all. So we told him to discontinue the St. John's wort. And then in 2 weeks, 14 days, start the venlafaxine because of that risk for serotonin syndrome.
How did the patient respond to coming off of it? Were they open to it or was it pushed back initially?
Yeah, no, they were pretty open to it. But I mean, just I guess a good catch,
Yeah, for sure. St. John's wort is you can almost always find a drug interaction with that drug. So yeah, what else you got? What other good ones there?
Let's see. So I feel like we could talk about supplements for days. Yeah, without going into too much detail, there's a few you want to be on the lookout for that could increase bleeding risk. So if your patients are already on anticoagulants, warfarin, the 5Gs, so garlic, ginger, ginkgo, ginseng, and glucosamine are all going to have a bleeding risk. High doses of fish oil, vitamin E are the most common ones. So those are something to look out for.
I think turmeric also has increased bleed risk too. And correct me if I'm wrong, but I believe all of those are more so dealing with platelet aggregation and decreasing that process. So it's almost like taking in a low-grade antiplatelet along with your anticoagulant.
Just for fun.
Yeah. No stents, just for fun.
Yeah, no. There are a couple with liver warnings and are hepatotoxic, such as black cohosh, which is commonly used for menopausal symptoms, kava, which is used for stress. So those are the two that really come to mind. There are a couple with cardiac risk. So to look out for in our patients with heart failure, ephedra and bitter orange are two.
Bitter orange.
Yeah, because they are technically stimulants. Mm-hmm. So, yeah, we know all about that. And then yohimbe, which is used for ED, and it raises the blood pressure, so it would increase heart rate.
Yeah, no, that's true. I because that was in that those ridiculous products that were the male enhancement stuff that they were selling at Walgreens of all places,
yeah.
And I was with all natural yohimbe. It was all the people with tons of cardiovascular diseases were buying it. It was no,
right?
This stuff doesn't work at all, and your heart's gonna explode.
Yeah, it comes to get their heart failure meds and a bottle of that on the side.
Yeah, Extends and all these other ridiculous products. Who let this on the market? This is insanity.
Probably the same people that are compounding Ozempic for fun.
Listen, there's some soldiers out there compounding legit Ozempic. How dare you? There's also a whole bunch of them compounding not legit Ozempic, but that's neither here nor there.
That's their business.
Yeah. We're not doing crime investigations on this show just yet until we run out of topics.
Oh, well, let me know when you do because I'll be here for that.
We'll just turn this into a bounty hunter podcast.
True crime.
We probably get way more listeners. Anything else supplement wise that you've been looking at lately or got you interested?
Well, one more thing with health risk before we transition is caffeine, and I'm guilty of this myself because I'm drinking my coffee. My third coffee of the day. But so caffeine will raise blood pressure and increase heart rate. So it's also something to be mindful of in our patients, coming into the pharmacy for their blood pressure medication and their heart medication. We actually just put a beverage shop in our pharmacy called Roots, and they do energy teas. And so we've just been, saying you need to let patients know that this has the amount of caffeine as an energy drink because they're coming to get their lisinopril here. You can't, just not let them know this has 200 milligrams of caffeine in it and they're taking it home with them. So that's something to think about.
Did you see that the new AFib guidelines when they updated, they took away the recommendation of telling AFib patients to stay away from caffeine? They said that it doesn't actually reduce the risk of episode, like further episodes or worsening. So they said that you don't have to counsel against that for AFib specifically.
Wow. I should let my dad know. He does have AFib, and at his last visit, his doctor told them like no more caffeine ever. Stop that.
What an amateur. Doesn't even keep up with his material. This guideline's been out for months.
What are you doing?
Yeah, I thought that was pretty. We just did AFib like last week or 2 weeks ago, so that I thought that was one of the biggest takeaways I had from the whole.
I'll have to read that
guideline. What do you use as far as like resources for supplements and things? Do you have any that you prefer?
Yeah, my go-to is Natural Medicines database for sure. I think they do a great job of breaking down indications and then like level of evidence for each one, and then generally recognized as safe and effective or whatever on each indication, and then a great side effects, interactions with other medicines and supplements. That's always a good thing to look at too.
I mean, that's definitely, and I've said this before in the podcast, so people are going to think I'm like plugging them as a sponsor. They're not a sponsor. I just genuinely think that Natural Medicines database has, I mean, if you can't find a supplement in there, it probably doesn't exist.
Yeah, you might not need to take it then.
Yeah. I mean, it's so in depth with, encompasses so many different, herbal supplements, and just everything you could think of. So it's a very good resource. LexiComp also has a natural medicine section. It's not quite as, robust, but it's a decent one if you need a quick reference for a lot of the common ones. But Natural Medicines database is what I like as well.
Especially, I do like LexiComp, but I find when I'm doing my supplement consultations and I have the whole med list and I want to make sure there are no interactions there, Natural Medicines is a little bit better at the interaction checker for including supplements than LexiComp is.
So, not to totally switch gears, unless you have something else you want to go to, but I do want to hear about this writing gig you got going on.
Oh, right. Yes. Thank you for that. But yeah, so actually through my RX Cheat Sheets account, I found this Sports Pharmacy Network account. And sports pharmacy has always been an interest in mine, obviously, because I'm so interested in supplements and vitamins and natural medicine. And being an athlete myself, I thought that was a cool untapped area of pharmacy. So we got connected, and they're a pretty new organization, just established last year. And they just focus on providing an interdisciplinary platform of applied science and clinical knowledge to optimize the health and performance of athletes and protect clean sports. And it's a pretty emerging field, I'd say. Not too many sports pharmacists out there, which I think is pretty cool and unique. But they work collectively with other key players on an athlete's team to synergize health and overall performance. And I believe they're just launching their membership model next month. But you can go to sportsrxnetwork.com to become a member, and you will get a newsletter in this membership written by yours truly. So
did you write the whole newsletters? You had to do the whole thing?
Yeah, I mean, it was one article I summarized.
Oh, but still.
Yeah, and actually, that was on a supplement, obviously. I talked about the creatine augmentation of SSRIs. Cool. To kind of help those kick into action a little bit sooner. We know a notorious setback of the SSRIs are delayed onset, right? Mm-hmm. So this study actually showed, and it was the first of its kind, to establish the benefit of augmenting SSRI treatment with oral creatine to demonstrate accelerated antidepressant efficacy. But interestingly, it's in females only that we do see a benefit. Did they say a
mechanism or anything?
So the
pose mechanism?
Right. So they're theorizing it's because the abnormal cerebral metabolism associated with depression has been more commonly reported in women than in men. And females are known to have a greater energy producing capacity and lower reactive oxygen species production, which could play a role in like the sex dependent effects of creatine.
That's interesting. Mm-hmm. So that's your first paper for them, or first article you written for them. Did you enjoy like doing the process, writing it?
Yeah, it was so fun. And I learned so much doing it. I had never heard of this before I read the article. But I think it was fun, and I'm excited to keep doing it for them and have a new study to look at every month. It's going to keep me on my toes for sure.
Yeah, that's awesome. Good for you too, because you came about that because of RX cheat sheets, right?
I did.
So kind of when we were sitting down in rotation, we were talking about like, you never have any idea how all of it will end up benefiting you, but it usually will. It's never going to give you. You're never going to be further back because you wanted to keep up with stuff or put your insight into the world as far as your notes and all that stuff.
Right.
I've said this till I was blue in the face with a student, but and if anybody's listened to the podcast for a while has heard me say it too, but I highly recommend anybody who has any sort of like, whether it's like Kaleigh does with her notes and makes them look amazing, versus mine look, you couldn't pay someone to try to study with my notes, versus someone who's does very well at speaking or video or whatever it may be, whatever your thing is that you like writing, but using that as a way to like kind of keep up with your pharmacotherapy knowledge and your evidence-based medicine, but also getting your word out and your name out there into the medical universe, if you will.
Right.
Social media is a very good tool for that, and it's becoming more and more prevalent now, where people are starting to realize that it's not as unprofessional or whatever. It's,
no, I will say the one thing I still can't get on board with is TikTok, but
give it time.
I know I'll spend way too much time on there, but I do still have a folder in my email for the pharmacy articles you had us sign up for on rotation. Really? It's like 6 of them. But yeah, I remember that was like the first thing you said to us. You said if you read one of these like a week or whatever, you'll be, on up there, because I guarantee you after graduation, half of your class will.
Yeah. It's so crazy how like if you just do like the bare minimum, people are like, you're a rock star.
Yeah.
Like, I mean, I guess.
Yeah.
But no, good for you. I'm especially with residency and all that. I think the vast majority of people would have put it on hold if nothing else. So good on you for sticking with it. So tell us one more time where we can find you at if they want to follow you or.
Right. So my Instagram is called RX Cheat Sheets. It's RX.cheatsheets.
And is it safe to say that I'm officially like the biggest influence in your career, or is it?
Oh, yeah, for sure.
For sure. Cool. Just want to make sure I get that on recording.
RX Cheat Sheets would not exist without you.
Yeah, exactly. So I've really laid the foundation for it. I'm just kidding. I didn't. I basically gave you like 3 seconds of advice and you just ran with it.
Yeah, and I don't even think we used the logo you came up with.
No, we definitely didn't. Mine was, I think I did mine like in between patients one day. So no, I'm glad you went with yours. It looks much nicer.
Yeah, thanks to Emily for that one.
Yeah, Emily. She's only been on the podcast twice. What amateur.
Yeah.
All right. Anything else you want to share before we get out of here? I appreciate all your time. I don't want to keep you too long.
I do not think so. But if we ever do want to do a deep dive on other vitamins or supplements, call me up for that.
Absolutely.
Like I said, I have notes and notes for days on that. But
we'll do it. Maybe we'll even do like a mini series like for YouTube or something.
I think that would be cool.
That'd be cool. That we can really dig into like the individual ones and.
Yeah, and I think people are starting to get a little bit more interested in, vitamin supplements, over-the-counter treatments, natural medicine.
And if they're not yet, we're going to freaking make them.
Yeah.
Yeah.
I can convince them.
Yeah. I'm just going to convince them to get interested in it, and then I'm just going to tell them it doesn't work, and they're going to be so confused. That's my job, is to instill confusion. Kaleigh, appreciate you being here. It's good to see you again all these months later. And it's crazy because that was your first rotation. It's crazy that doesn't seem like that long ago.
No.
And I've been with the new job for over a year, and I had a whole bunch of students after. So it's like, gosh, like a year and a half went by quick.
It did.
But y'all make sure to go check out Kaleigh's Instagram page, follow her, and keep up with what she has going on. If you want more like lecture style, PowerPoint, old school content, you can check out Patreon, patreon.com/coreconsultrx. It's basically my physician assistant lectures that I do, pharmacotherapy lectures that I do, and it includes PowerPoint slides, all kinds of different various disease states. There's like over 100 lectures on there now, and it's fairly cheap as far as review courses and things like that go. And then also, if you haven't already, I know I've mentioned this a lot, but Pearls is a great drug info app that is growing monthly as far as the content they have. They've been a long-time sponsor of the show, so pearls.com/coreconsultrx. Make sure you check that out. And another sponsor of the podcast is I'm pretty sure that you guys have all heard of this book by now, but if you have not, please go check out High Powered Medicine by Dr. Alex Poppin. It is a fantastic summary of various landmark clinical trials and gives you all the highlights of the trial and the pertinent information, and then you can go from there if you need more elaborate information or more in-depth information. But great summary, great reference to glance at real quick. And if you sign up for the Patreon and pay for a year's membership, which is like $30 and some change up front, Alex has given me permission to give you a digital copy of High Powered Medicine at no charge as a gift. So make sure you check that out. Thank you to Alex for sponsoring. Thanks to Pearls for sponsoring. And Kaleigh, thanks for being here in between all your busy schedule and whatnot. We definitely appreciate it.
No, thanks for having me.
No problem. And Joe, thanks for my brother Joe's been working the cameras and stuff today. So Joe, thank you, man. We'll catch you guys in the next one. Have a good one.